Chapter 13, Central Nervous System, Stimulants, and Related Drugs. So CNS stimulants are drugs that stimulate a specific area of the brain or spinal cord. The sympathomimetic drugs. They are classified according to chemical structural similarities, so amphetamines, serotonin agonists, sympathomimetics, and xanthines. The site of therapeutic action in the central nervous system, and major therapeutic uses like anti-attention deficit disorder, anti-narcoleptic, anorexant, anti-migraine, and analytic drugs. We also have caffeine, and you can use with caution in patients with history of peptic ulcer, recent myocardial infarction, and dysrhythmias. So ADHD stimulates areas of the brain responsible for mental alertness and attentiveness. Anorexant is to suppress appetite control center in the brain. An analeptic is the neonatal apnea, to treat neonatal apnea, bronchopulmonary dysplasia, post-anesthetic respiratory depression. ADHD, it is the most common of psychiatric disorders in children, affecting 4 to 10% of school-age children. Boys are affected from 2 to 9 times more often than girls. Primary symptoms of ADHD are inappropriate ability to maintain attention span or the presence of hyperactivity and impulsivity. Drug therapy for both childhood and adult ADHD is the same. Nursing implications for drugs with ADHD. Last daily dose should be given 4 to 6 hours before bedtime to reduce insomnia. Take on an empty stomach 30 to 45 minutes before meals. Drug holidays may be ordered. So what that means is, let's say a child is taking this let's just say they're in 4th grade or something. So a drug holiday would be if the parents and the physician has decided during Christmas break the child will not take the medication. So they go on breaks in the medication, or maybe they go on a holiday over the summer. They take them off the medications. We have to instruct the parents to keep a journal to monitor the child's response to therapy. Monitor the child for continued physical growth, including height and weight. ADHD medications are known to have an effect on weight. We have to watch them closely to make sure that they're eating. It is an appetite suppressant, most of the medications for ADHD. Amphetamines included in this in this treatment regimen are the ones listed here. Adderall being probably the one that you hear the most about. It's one of the most commonly prescribed drugs for ADHD. Shows Strattera is approved for treating ADHD in children older than 6 years of age and in adults. In September 2005, the FDA issued a warning describing cases of suicidal thinking and behavior in small numbers of adolescent patients receiving this medication. So here's a question. A teenage boy will be receiving Strattera as part of treatment for ADHD. Which statement about this drug therapy is accurate? A, Strattera is highly addictive. B, psychotherapy is rarely helpful in these cases of ADHD. C, the patient should be monitored for possible suicidal thoughts and behavior. Or D, Strattera is used to treat narcolepsy as well as ADHD. Well, based on the last slide, I'm sure you know the answer to this. Everybody decide C, right? All right, then we have Ritalin. Ritalin is the first prescription drug indicated for ADHD. It's also used for narcolepsy. We do have extended release dosage forms, which is the name of those are Ritalin SR, Concerta, and Metadate CD. Anytime you see SR or CD, that indicates extended release. Then you have Provigil, which is improvement of wakefulness in patients with excessive daytime sleepiness associated with narcolepsy and with shift work sleep disorder. There is less abuse potential than amphetamines and methylphenidate. It is a Schedule IV drug, and Nuvigil is similar to Provigil. Anorexiants is used to treat obesity. Anorexiants listed here, you'll see the names of some common anorexiants that you will see on the market. Phentermine, benzamphetamine, methamphetamine, those are all very common. Other drugs to treat obesity include oOrlistat. It's related to a non-stimulant drug. It's used to treat obesity. The mechanism is it works locally in the small and large intestines where it inhibits absorption of caloric intake from fatty foods. And you also have the other two listed here, iorcacerin, Belviq, and Quicemia or Topermate. The mechanism of action is to suppress the appetite, control centers in the brain, increase the body's basal metabolic rate, mobilization of adipose tissue stores, and enhance cellular glucose uptake, reduce dietary fat absorption. We have adverse effects, of course, that include possible increase and elevated increase in blood pressure and heart palpitations, anxiety, agitation, dizziness, and headache. Migraine is a common type of recurring headache. It usually lasts from 4 to 72 hours. Typical features include a pulsatile quality with pain that worsens with each pulse, most commonly unilateral, but may occur on both sides of the head. Associated symptoms often include nausea, vomiting, photophobia, so light is bothersome. The patient wants to avoid light, and phonophobia, which is the avoidance of sounds. So they want to be in a nice quiet room with the lights off. They may also experience an aura, so a visual disturbance. Anti-migraine medications, serotonin agonists, also called triptans. So if you take a look at this list here, look at the generic drug names. All of the endings of the medications all end in triptan, Triptan. That is how you can associate with an anti-migraine. All anti-migraine medications, the generic name, end with triptan. Sumatriptan, almotriptan, elatriptan, naratriptan, rizatriptan, zolmitriptan, fravotriptan. Then you have ergoalkaloids. They were the mainstay of treatment of migraine headaches, but have been replaced by the triptans for first-line therapy. The way that they work is they narrow or they constrict the blood vessels in the brain, excuse me. So for triptans, the mechanism of action is to stimulate the 5-HT receptors in the cerebral arteries, causing vasoconstriction and reducing headache symptoms. Reduce the production of it does also reduce the production of inflammatory neuropeptides. The ergoalkaloids, adverse effects include nausea, vomiting, cold, clammy hands and feet, muscle pain, dizziness, and others. Triptans include vasoconstriction, irritation at injection site, and tingling and flushing. Let's talk about sumatriptan, or Imitrex. It is the original prototype drug for this class. There are 7 triptans. Slight pharmacokinetic differences exist between some of these products. The effects are comparable overall. Aimovig is specifically designed to help prevent is the key word, migraine. It selectively targets and blocks the calcitonin gene-related peptide receptor CGRP/R, disrupting a key component of migraine pathophysiology. You do a self-injected dose monthly. And down at the bottom of the slide is a link to the drug, directly to the drug manufacturer if you'd like to read more about it. Nursing implications, you're going to assess for potential contraindications, potential interactions, including herbal therapies, conditions such as abnormal cardiac rhythms, seizures, palpitations, and liver problems. For children, you're always going to assess baseline height and weight. Back to drugs for ADHD, our nursing implications. We want to take note of last daily dose. Once again, should be given 4 to 6 hours before bedtime to reduce insomnia. Take on an empty stomach 30 to 40 minutes before meals. Drug holidays may be ordered. Instruct patients to keep a journal to monitor the child's response to the therapy and monitor the child for continual physical growth, including height and weight. Nursing implications for migraines. So with the serotonin agonists, or SSRIs, dissolve wafers, nasal spray, and self-injectable forms. Provide specific teaching about correct administration. Instruct patients to avoid foods that contain tyramine. Very important. You might see an NCLEX question about that. Instruct patients to keep a journal to monitor response to